your first question is coming from the audience. It's right here in front of you.
Good afternoon. My name is Ron Madej. My wife and I rely on our Social Security and Medicare to live. We both have pre-existing conditions, so making sure our health conditions are covered and affordable to treat is essential. What would you do if elected president to ensure Medicare and Social Security are secure and sustainable for the people like myself receiving it and for the younger Americans who are going to need it just as much?
First of all, thank you all very much for having me here today. Thank you to AARP and all the people who are here. Thank you very much, sir, for the question. I appreciate it. And this is, of course, something that is on the minds of very many Americans, both Americans who are on Social Security now and Medicare now, and also many who know that they're going to be, hopefully on Social Security or Medicare in the future. Here's what I would do. Number one, what we see is that we have baby boomers that are turning 65 at record numbers for your generation and drawing down on Social Security. You earned Social Security, and so Social Security should always be strong and there for you. And that means that we need to look at ways to make sure that the Social Security Trust Fund is strong well into the future. As you all know, right now it's estimated that by 2035 it may be essentially in danger. Here's what I would do. I would increase the payroll tax beyond $130,000 to fund the Social Security Trust Fund. I would absolutely look for new revenue that we can put into the Social Security Trust Fund to ensure that it is stable for the long haul. I don't agree with those who have said that we should somehow cut Social Security or take those benefits away from Americans, because I believe that you did earn it, and that in this 21st century we need a strong 21st century safety net for our seniors. Let me address Medicare, and then let me connect the dots of what I think that we need to do very briefly. I believe that what we need to do is transition to a healthcare system that uses Medicare as its base, strengthens Medicare for the people who are on it, and then makes Medicare available to all those who want it. We need to strengthen Medicare, though. I believe that we need to allow the negotiation of drug prices by Medicare. We need to support the importation of drugs from countries that have a safe vetting process like Canada, so that people can get those prescription drugs that they need more cheaply. There is no reason that insulin should cost several times more here in the United States than it does in Canada or other countries. I grew up with a grandmother who had type 2 diabetes, and right before she passed away in early 1996, she had to have one of her feet amputated, which, as y'all may know, is very common for severe diabetics. That whole time she had Medicare, and I saw the difference that Medicare can make. I'm absolutely committed to strengthening it and making sure that those who want it can also get it without risking degrading the program. We need to improve the program for the people who are on it. Finally, very briefly, let me connect this to some of the other issues that have come up in this campaign. Maybe the prime issue that this president wants to run on is this issue of immigration, right? He's trying to scare a lot of Americans with fear and paranoia and division into believing that we can't handle this immigration challenge. I've offered a strong and compelling alternative vision on immigration that says we can maintain border security, but we should do that with compassion and common sense. I've also said that the truth is that we need a lot of these folks who want to come to the United States. Because we have Social Security that is being drawn down on at record numbers, because last year in the United States we had the lowest birth rate in 32 years. We have an unemployment rate right now that is at 3.7%. We see countries across the world like Japan that are grappling with this issue of having an aged population and not enough vibrant young workers. We don't want to go down that path. Part of the answer to make sure that we have a young, healthy, vibrant workforce that can support the Social Security Trust Fund well into the future is to ensure that we have a sensible immigration policy that allows for that young, healthy, vibrant workforce. So I believe that if we do it right, we can maintain border security, we can address the issue of immigration by partnering with Central American countries so that people can find safety and opportunity there without coming in droves over here. And we can harness the talent from around the world to have that young, healthy, vibrant workforce that will help fund Social Security and other programs well into the future, and all of us can win in the United States with it.
Just a quick follow-up on Social Security. You said raise the $133,000 income cap. Would you eliminate that cap, or would you raise it to a specific level?
Well, during the course of the campaign, we're going to release our plan for this, but...
you can do it today.
I know.
What are these
They
people
always
here
want
for?
folks to make news, I know. But in the least, I think we need to significantly increase it. Yeah.
You mentioned immigration, but where you are in Texas, there's also a lot of people from America who go across the border for medical treatment.
That is true.
What, as president, would be your approach to that cross-border medical trade? And also cheaper prescription drugs, that's why they go as well. What would be your approach to reducing the cost of prescription drugs?
I mean, you're right. I'm from San Antonio, Texas. Hopefully some of y'all have been there. The Riverwalk, the Alamo. It's a beautiful city. We have a lot of folks down there in Texas, in those border states, as many people here will know. Probably y'all have relatives or you have friends that live down there that go down to Mexico to get prescription drugs that are a lot cheaper. Some of them go to have medical procedures done. Same thing of people going to Canada. Well, my number one, the way that I think about that is that shouldn't be the case. It shouldn't be the case that people need to do that, right? We should have an America where people can get those prescription drugs at the same rate as in these other countries, and also can get procedures for the same or less cost than they do in Mexico or Canada, and we can do it better here in the United States. But if we're trying to make incremental improvements in a system, I would say that we have to allow for the negotiation of drug prices by Medicare directly with these pharmaceutical companies. Secondly, we have to ensure that we can import drugs from places like Canada that have a strong vetting process for their drugs. I also believe that we need things like patent reform to close some of these loopholes that essentially allow these drug companies to keep renewing the patents on life-saving drugs and then jack up the prices so that people cannot get them for a reasonable price. There's no reason that that should happen, especially when it's the case that you and your family as taxpayers are the ones who fund a lot of the research and development for these drugs. That doesn't make any sense. We need to address that legislatively, and that's another thing that I would do.
Let's focus on the healthcare system, just real quickly, on a number of fronts. As you know, the former vice president came out with a plan yesterday adding a public option to the Affordable Care Act. Is that what's most doable?
Well, I mean, the way that you asked the question in terms of doable politically or ideally, the system should we have,
That's your
right?
answer, sir.
Look, number one, I think that on January 20th, 2021 at 12:01 p.m., we're going to have a Democratic president, a Democratic House, and a Democratic Senate in this country. And so we're going to have this opportunity to make big changes that need to happen that are in the interest of the American people, make those things happen. What I believe is that we should base our system off of strengthening Medicare and then expanding that to everybody who wants it. But if somebody wants to have a private health insurance plan that they're happy with, that is a solid, strong plan, I believe they should be able to hold on to it. And you see in Europe different systems where that's the case. Somebody can have a supplemental private health insurance plan. I think we can accomplish both of those things. So that's my vision.
Although last time there was a Democratic president and a Democratic House and a Democratic Senate, they couldn't even get the votes really to add a public option, that they had to settle for what we have with the Affordable Care Act. Do you feel like that the public sentiment has changed that much just in the last 4, 8 years, 10 years?
I have two answers to that. Number one, I do think that public sentiment has gotten stronger and stronger to make sure that there's universal health care coverage out there. Because Americans of all different backgrounds realize that when countries around the world have already solved this issue, there's no reason. We live in the greatest nation on earth. There's no reason that we shouldn't be able to address this issue and solve it and provide universal health care coverage. But my second answer is, look, if we have a Democratic president, Democratic House, Democratic Senate, which we've had in 1993 and in 2009, 2010, the lessons of those years are you have to go for it. And I would go for it, including to jump over a filibuster. If the choice for me is between universal health care coverage for all Americans that's strong, that is good, or adhering to a 60-vote filibuster rule that is nowhere in our United States Constitution and has been abused by both political parties when it's convenient for them, I'm going to choose universal health care coverage. So my answer is that we won't need 60 votes. We'll need less than that.
Mr. Secretary, you have proposed a rent tax credit and said it would be a Social Security-like benefit. How would that work?
Well, I've actually proposed two types of investments that would work to ensure that people are able to get safe, decent, affordable housing. Let me begin by saying that I look at housing as a human right. I think in this nation that we should work hard so that everybody has a safe, decent, affordable place to live. And two of the things that I've proposed in my housing plan are the one that you mentioned, a renter's tax credit that they would be able to get back so that they could better afford the rent, that we would be able, I would like to structure as a monthly payment. Folks know that in places, including in Iowa, people are paying 50, 60, 70% of their income in rent. We have a rental affordability crisis in this country, not only in the usual suspect cities like Boston or New York or San Francisco or LA, but also here. The rents are going up all over this place. The second initiative that I would do is that I would take the Housing Choice Voucher Program and I say that anybody that earns less than 50% of the area median income, that you would be entitled to a Housing Choice Voucher. Remember, with a Housing Choice Voucher, that doesn't mean that it's totally free. You get into the private market and you have to pay basically 30% of your income in rent. But it would give them a voucher to be able to go out and get housing in the private market. I think we need those two things if we're going to address the dire need for housing out there. My plan also would invest in creating more housing supply, because it's not just a matter of giving people a housing voucher or folks a tax credit. You also need to create greater supply out there. That's why I've called for investing $40 billion in the National Housing Trust Fund, $5 billion in the Capital Magnet Fund, which deals with renovating, repairing, and increasing public housing, because we need, and also increasing the low-income housing tax credit that has been our best asset for those kinds of units. If we do both of those things, I'm confident that we can address what is a real crisis of affordability out there in our housing market.
Mr. Secretary, Senator Gillibrand was just out here and was talking about an idea that she's just developing at this point to provide a universal basic income to people who work full-time as direct caregivers. So they might work in the family, they're not getting paid, but they're working 40 hours a week as a direct caregiver. What do you think of that idea, and what's your idea for helping people deal with the fact that they might have a second full-time job, working as a caregiver for their family, or that may be their full-time job?
Yeah, no, and I hope that she does develop it. I look forward to, one of the things that's true, if I were just a voter, a spectator in this race, y'all have an embarrassment of riches of candidates that are running this time, 24 candidates, but a lot of folks with great ideas, that are honest, that are hardworking, any one of which would be a better president than the president that we have right now. And to answer your question about a universal basic income approach, there is legislation that Senator Booker and others I know have sponsored in the Senate to pilot universal basic income in the United States, which I support. I think that we should get a sense in the next couple of years of how that would work. And I think the pilot is in 25 different communities, as I understand it, in our country. Because as y'all see, what's happening here in our economy is it's rapidly changing. It's different from before. A lot of the companies that used to offer a pension or even a 401k program, they no longer are offering that. They're putting people as independent contractors. or lowering the number of hours that they'll employ them for so they don't get any benefits. Also, this gig economy that we're getting more and more into, people that are driving Uber, driving Lyft, or doing other things, they're considered independent contractors. They don't have any kind of benefits, nothing to build on, nothing to save for retirement. What that means to me is that we do need to step in more robustly and address that. And that the federal government, working with communities out there in the nation, has a more robust role to play, not in taking over. You're not going to take over the private sector, but you're going to fill that gap. And so the way I think about it is a 21st century safety net for people given the new realities of our economy that supplement what they're able to earn in the private sector. I believe in that, and so I look forward to Senator Gillibrand coming out with that idea, and I'll take a look at it when she does.
Let's address the issue of age discrimination. As I'm sure you recall, President Obama signed an executive order that prohibited government contracts from going to businesses that were judged to be discriminatory, have a discrimination record. What would the next step be?
Well, I believe that the next step is to absolutely make sure that in the context of housing, employment, and as you know, age discrimination is a real issue in employment, I think especially, and in every other way, that we actually enforce the laws that we have on the books and then look at, with our changing economy, are there new laws that we need to pass to ensure that people who are seniors are not discriminated against. When I was at the Department of Housing and Urban Development, we focused a lot on fair housing, based on the 1968 Fair Housing Act, to ensure that no matter who you are, you can't be discriminated against because of anything, whether it's your age or it's your race or ethnicity or sexual orientation or gender identity. Oftentimes we have these laws on the books, but the truth is that we don't enforce them nearly enough. I mean, I bet that y'all have stories, the folks here, of friends of yours or colleagues of yours that, or maybe you have, believe that you've experienced discrimination based on age, right? And sometimes, if it's an employer, potential employer, if it's a potential landlord, somebody needs to make sure that folks are held accountable so that they don't engage in that conduct again. But right now, we don't have the resources dedicated to actually enforce effectively a lot of our anti-discrimination laws. And so I would put the resources into actually enforcing those laws to back employers and others who would discriminate against the elderly off from doing that effectively.
As mayor in San Antonio, you sought to reduce your city's obesity rate. How did you go about that? I think it was initially successful while you were in office, but it's been going up since you left office. So what would you do as president also to encourage wellness and physical fitness?
Yeah, well, I grew up with my mother and my grandmother, and my grandmother had come from Mexico when she was 7 and worked as a maid, a cook, and a babysitter, raised my mom as a single parent. My mom raised my brother and me as a single parent, but both my mom and my grandmother were obese and had diabetes. In fact, my grandmother, as I mentioned, she died from diabetes, and my mother has diabetes now. And so I saw my entire life growing up the impact that some of these afflictions can have and that are related to obesity. And so I worked as mayor as much as I could to try and inspire folks to know about healthy eating and about what they could do to exercise. We also invested in programs, including in our park system, because I think one of the greatest things about communities are parks and our libraries, right? To get people active, to do that as a family program, to encourage in a safe way in our parks folks to walk around on the track, and to model that. And also we roped in some of our restaurants to offer healthier items on their menus and to let people know the calorie count of what they were eating. Because I firmly believe that you can't force somebody to be healthy, but you can give them the information and the resources and try and encourage them to do that. And that's what we were trying to do, and it did have a good impact while we were there. I believe that if we do that and we invest in public health, that we can bring down the rate of things like diabetes and other afflictions, heart disease, that often mean that people's quality of life is diminished and that people die earlier, unfortunately. But we can do something about that.
Is there something that you would do as president on a national scale?
Yeah, absolutely.
Along those lines.
I would invest in public health programs out there in the United States. I would do everything that I can to hopefully, I can't say that I always have the best diet, although I've gotten better. But also to work with local school districts, for instance, to ensure that they're serving healthier food. I'm a big fan of what First Lady Michelle Obama did during their tenure to build on that work. And also with our seniors in so many communities, giving folks spaces that are safe and comfortable for people to go out and to walk around a track or to exercise. We have that in some communities you don't. And also investing in things like basic infrastructure, like sidewalks, that often prevents people from being able to exercise. If I can, let me just very briefly tell a 45-second story where the light bulb went off for me on this. When I was in my first or second year as a councilman, I was 27 years old or something. I went to this neighborhood meeting as a councilman in my district, and we were talking about the budget. And after the meeting, a woman that must have been in her late 30s or early 40s came up to me, and she said, "My mother was just diagnosed with diabetes. And I was hoping that you could get money to put sidewalks on her street, because her doctor just said that she needs to walk around to increase her blood circulation, for her health." But the woman told me that there were no sidewalks on this street and that her mom had been living there 30 years. And that was the moment that for me, the light bulb went off of how all of these dots are connected. Something as simple as sidewalks to somebody's health and the overall quality of life in a neighborhood and the safety in a neighborhood. That's the way that I see the work that we have ahead of us, is to connect all of these dots between health, between infrastructure, housing, jobs and opportunity, transportation, and so forth.
I don't know if we qualify smartphones as quality of life, but there are a whole lot of spam calls, and research shows that sometimes when we age, we're less able to detect when we're being scammed. As president, would you tighten laws? Would you increase fines? How would you address this conundrum?
No, I'd say all of the above. I would like to see us tighten some of the laws. I won't lie to you, I have not delved into all of the research on exactly how we would restrict, further tighten those laws, but that's my sentiment. I believe that we need to. And also increase the penalty for people that violate, especially when you've said do not call and people still call. Now, I feel like I have to apologize as a politician for the calls that you still do get. Please forgive us, all right? Forgive us. But a little bit more seriously, I have this, my mother is 72 now. My mom was a hellraiser when she was young. She was part of the old Mexican-American civil rights movement and worked on a lot of women's empowerment issues. And she's 72 now. We've had this conversation that she tends to answer her phone all the time, and I say, there are a lot of people that call that don't necessarily have the best intentions. And I know that we have in this country, and I'm sure in other countries, this issue of especially senior citizens who sometimes get scammed. We want to make sure that we tighten laws so that that doesn't happen, but if it does happen, that the people who do it are punished, so that it sets a strong example so that others will not do it. That's the kind of approach that I'd like to take.
We're running short of time, but I wanted to make sure that we touched on this issue. As mayor, you dealt with public pensions, correct? And public pensions, that's sort of like the 20th century safety net, right? You mentioned the 21st century safety net. Well, the 20th century safety net is going insolvent all over the country. What directly would you do, if anything, to shore up public pensions especially? Yeah,
well, the way that I see public pensions is that folks earned that pension, right? They were promised that pension. And so when I was mayor, I established a commission to look at the health of our public pensions, because we had seen what happened in places like Dallas and what was happening, I think, in Houston and other communities in the United States. And we wanted to make sure for our public safety first responders that those pensions were always strong. Fortunately, San Antonio's pensions have been some of the strongest in the country, but that's not the case everywhere. And so, I look forward from the perspective of being a strong partner in Washington to what we can do to help ensure that pensions are strong. As you know, a lot of that is dealt with at the local and the state level. But to the extent that there are ways that Washington can be a strong partner, then I'd absolutely be willing to do that.
Okay. We'll give you just a few minutes just a few seconds, I guess, not a few minutes, if you want to take a minute to wrap up.
Yeah, well, I wanted to say again, gracias. Thank you very much for having me here today, and to everybody for being here. What I believe the destiny of this nation is in the years to come is to be the smartest, the healthiest, the fairest, and the most prosperous nation on earth. And that over these last 2 years, unfortunately, we've been so focused out of Washington on division and polarization. We have the greatest nation in the world already. And I don't want to go backward. I don't want to make us anything again. I want to make us better than ever. I want to take us into the future. And over the next several months, I'm going to be here a lot in Iowa, articulating that vision and how we can get there. And if I'm elected president, I want you to know that I'm going to keep my eye on the ball, that I'm going to work very hard so that you and your family can have great health care when you need it, that your Social Security is always solid, that your grandchildren can get a good education, and that there are great opportunities whether people live in a big city or in a smaller community in our country. Because I believe in an America where everyone counts, and that's the kind of president that I would be. Thank you very much.
Thank you.